Welcome to this video guide on eye health. If you are living with diabetes or macular degeneration, understanding your vision is essential. This is a plain language guide meant for education, not medical advice. Please remember that this video is for educational purposes only. It is not a substitute for a professional diagnosis, treatment plan, or a hands-on exam. Always consult your own eye care professional, and if you notice any sudden changes in your vision, seek care immediately. In this video, we will cover 5 essential parts, starting with the 2 silent threats to your sight, what experts and research say, the barriers you might face, and practical steps for protecting your vision. The big idea is that much vision loss is silent yet preventable. Conditions like diabetic eye disease and macular degeneration often cause no symptoms until it is too late. Regular checks are the best way to catch them early. Let's begin with our first section, 2 silent threats to your sight. We will look at what these conditions are and why they are so good at hiding. To understand these conditions, let's look at how the eye works. Like a camera, light enters the front and focuses on the retina at the back. The macula is the central part responsible for sharp, detailed vision, and it is the main target of these diseases. Why is vision loss often silent? Because there is no pain or blur in the beginning. Damage builds up over years in the retina where you cannot feel it. That is why checking your eyes while they feel fine is so critical. Diabetes can weaken the blood vessels in the retina over time. This can lead to leakage and swelling. Diabetic retinopathy is a leading cause of blindness in working-age adults, yet 80% of people with diabetes will develop some form of it over time. In simple terms, retinopathy is damage to the eye's blood vessels. It progresses from small leaks to more severe bleeding and the growth of fragile vessels. Early detection is your best protection against permanent vision loss. Diabetic retinopathy progresses through stages from healthy to early, moderate, and advanced. Because it develops quietly, regular screenings are the only way to catch the disease before you notice any changes to your sight. Diabetic macular edema happens when fluid collects in the macula, causing central vision to blur. It can occur at any stage of retinopathy and makes reading or recognizing faces difficult. Fortunately, it is very treatable when addressed early. Now let's discuss age-related macular degeneration, or AMD. This is the wear and tear of the macula that occurs with age. While it affects central vision, peripheral vision usually remains unaffected. It is a leading cause of vision loss for those over 50. There are 2 main types of AMD, dry and wet. Dry AMD is more common and progresses slowly. Wet AMD is less common but can cause sudden vision loss. Wet AMD is now highly treatable with injections, making early action essential. You can perform a simple check at home using an Amsler grid. By covering one eye and focusing on the center, you can spot wavy or missing lines. If you notice any distortion, contact an eye doctor immediately. Many factors increase your risk, including age, family history, smoking, and blood pressure. In Saudi Arabia, where diabetes rates are among the highest in the world, being aware of these risks and scheduling regular eye exams is vital for everyone. Now that we understand the risks, let's explore what the experts recommend. Evidence-based advice is your best tool for knowing exactly how often you should be seen by an eye care professional. A practice guideline is expert advice built from research about the care that usually helps most people. While these guidelines exist, your specific eye care professional is the one who will tailor that advice to your individual needs. The core recommendation is simple. Get your eyes checked regularly, even if your vision feels perfectly fine. Finding trouble early, before you can see it, is what makes treatment work best. If you have diabetes, the timing depends on the type. For type 1, begin checks 5 years after diagnosis. For type 2, start at the time of diagnosis. Generally, these should happen every year, though your doctor may adjust this based on how well controlled your diabetes is. For macular degeneration, stay ahead of it by following your doctor's advice on exam frequency. Keep an eye on your vision at home with the Amsler grid to catch changes early, and always ask your doctor if vitamins are appropriate for your specific stage of dry AMD. A dilated exam involves a vision test, drops to widen your pupils, and a thorough inspection of the retina. It is painless, but your vision will be blurry for a few hours afterward, so plan to bring sunglasses and someone to drive you home. New screening methods are making it easier to stay on track. Retinal photos, telescreening, and AI-assisted tools help reach more people. While these are excellent for screening, they do not replace a full, in-person exam by your eye doctor. Moving into our third part, let's look at what the research has actually found. A major study of older adults asked a fundamental question: who is actually making it to their recommended eye appointments? This research followed a large, nationwide group of older adults across the 1990s, using their health records to see who received yearly eye exams and what influenced their attendance. The findings were a wake-up call. Only about 1 in 4 people with diabetes attended every exam during the study. While attendance for macular degeneration was higher, it still fell far short of ideal, showing that guidelines alone are not enough. Progress has been made since then, and uptake has improved. However, a significant gap remains, with about 4 in 10 people still missing their checks. The goal remains 100% participation for those at risk. Why do some people skip their exams? Most people use an intuitive mental math, weighing the perceived benefit of the visit against the effort or cost involved. When the effort feels too high, the checkup often gets postponed. The research identified what encourages attendance. Having a known eye problem, higher education levels, family support, and frequent contact with the medical system were all strong factors in getting people to their appointments. Conversely, barriers like difficulty traveling, living far from a provider, having memory concerns, or simply dealing with other serious health issues at the end of life often resulted in missed visits. Finally, the study found a catch. People were most likely to get exams when their disease was already serious. But the goal of these guidelines is prevention. We need to catch issues while they are quiet and treatable, not wait until symptoms appear. There is a surprising paradox when it comes to macular degeneration. In the past, many patients visited their doctors less often after an AMD diagnosis, feeling there was no treatment. That reasoning is outdated, as wet AMD is now highly treatable. Regular monitoring today is more important than ever. Research has uncovered a concerning gap in eye care. African American patients were found to be less likely to receive regular exams, even when accounting for income or education. This highlights structural barriers like access, communication, and trust that we must work to address. Insurance is a vital step, but this study showed it isn't enough on its own. Even with coverage, many people missed exams. Removing financial hurdles is just one part of the solution. We must also address the logistics and the personal belief that the care is worth the effort. Now let's explore the real-world barriers that get in the way of eye care. Understanding these everyday hurdles is the first step toward overcoming them. The first barrier is simply getting there. Distance to the clinic and limited mobility are major obstacles. Fortunately, these are among the most fixable barriers, especially through community transport programs, closer screening options, or the increasing use of telehealth. Other common barriers include cost, time, and competing health needs. For someone managing several chronic conditions, an eye exam can feel like the least urgent task. However, neglecting these checks can have long-term consequences that outweigh the temporary convenience of skipping an appointment. Memory, mood, and support also play a significant role. Conditions like dementia can make keeping appointments difficult, while depression is a known barrier to preventative care. A caring family member or friend is often the strongest boost to ensuring someone keeps their appointments. The role of the provider is key. Patients are more likely to attend when doctors explain the benefits, book the next visit, and send reminders. This is a universal need. Recent research in Saudi Arabia shows these same barriers exist where diabetes is common. It is time to talk about protecting your sight. We will look at practical steps for you and your family and discuss why there is more reason for hope than ever before. What can you do? Start by booking a dilated eye exam, even if your eyes feel fine. Know your recommended schedule, control your sugar and pressure, and do not smoke. Perform the Amsler grid check regularly, and if you see sudden changes, seek care immediately. If you are a family member or caregiver, you can help by offering rides, keeping track of appointments on a calendar, and watching for behavioral signs of vision loss. Your warm support and encouragement matter more than pressure or nagging. Health systems and clinics also have a part to play. Implementing automatic reminder systems, bringing screening into primary care or diabetes clinics, and ensuring appointments are convenient for patients are all proven ways to improve attendance and protect patient sight. There is great reason for hope. Advances in treatment for wet AMD, diabetic eye disease, and even the recently treatable dry AMD mean that early detection is highly effective. Regular monitoring is the key to preserving vision for years to come. To wrap up, remember 5 key points. Eye disease is often silent. Know your exam schedule. Barriers are real but solvable. Catch changes early. And finally, know that there is real hope because treatment works. Protect your vision today. Book your eye check now, even if you feel fine. For more information, visit resources from the American Academy of Ophthalmology, the American Diabetes Association, or consult your local health ministry. Remember, this video is educational, not medical advice.